Yeah, so whooping cough is most severe in young children, and particularly infants under 1 year of age, especially those who haven't received their initial vaccinations for whooping cough or for pertussis. However, it can also cause severe disease in adults who have underlying immune problems. So for example, let's say you're receiving chemotherapy for cancer, or you've had an organ transplant, or if you have some sort of underlying lung disease and your lung function isn't that good to begin with. Let's say you have severe COPD or cystic fibrosis. And so if you fall into one of these categories, you want to be vigilant and contact your doctor if you start having more severe symptoms.